Hello, all my beautiful ladies, and welcome back to our Impact Your Life channel and our episode 17 in our pregnancy and postpartum series. Today we're going to be talking about stability ball exercises for core stability and gentle mobility. My name is Christie Amundson. I am 36 weeks pregnant this week, so almost there. I'm in the home stretch, and I think that there's tons of pregnancy stability ball exercise videos out there on the web and on YouTube. So I really wanted to focus this video more on very core stability, gentle mobility, and things that can kind of help those of you like myself who are struggling with more pain issues. So maybe the typical pregnancy ball exercise video that you would find on YouTube, you aren't able to do because of limitations in pain and instability. So this is for you. It would be inappropriate to talk about core during pregnancy and the postpartum period without mentioning rectus diastasis. So what is rectus diastasis? It's basically you have your center abdominal muscle called your rectus abdominis. It's kind of like that six-pack muscle. It has two sides and is kind of connected in the center by a line called the linea alba, which is a connective tissue. And during pregnancy, due to the combination of the hormones that get released that relax some of your tissue, as well as your growing uterus, almost all women will have some degree of separation of that muscle. So it's like kind of the connective tissue stretches out a little bit and separates a little bit. So they don't actually usually diagnose rectus diastasis until you're in the postpartum period. But almost everybody is going to have some degree of separation. How much separation you have and whether or not it comes back to normal within a normal amount of time after pregnancy will be somewhat dependent on if you are more of a petite person, you're more at risk to develop a rectus diastasis. If you're carrying multiple babies, if you've had more than one pregnancy, or if you have poor or low muscle tone, or if you've had that condition before, you're at risk for developing this. Basically, you can test yourself whether or not you have that in the postpartum period. You really can't test for it during pregnancy. But you would lie on the floor on your back with your knees bent. You would take your fingertips, and with everything on the floor, you're going to take your fingertips, place them right at your navel, pointing down toward your feet. Again, this would be you laying on your back with your knees bent. And all you're going to do is just lift your head. You don't want to lift your whole body. You're just going to literally lift your head while you're pressing down with your fingers, and you're looking to see if your fingers drop into kind of a gully between the where the abdominal muscles separate. So depending on how many, usually it's measured in finger widths, how bad your separation is. And sometimes they say, two finger widths or more constitutes actually a diagnosis of rectus diastasis. But any degree of separation there where you're falling into a gully would be the separation of those muscles, and you're going to want to be doing certain things via your doctor's advice to address that, especially focusing on the other muscles in your abdominal area, such as your transverse abdominis, which goes around this way, and your obliques, which you will want to see a physical or occupational therapist and or your medical provider to help with that if it doesn't seem to be coming together in a reasonable amount of time. So we're going to be talking about the ball exercises today, and there's lots of different sizes of balls out there. These are only two. Usually there's actually four main sizes. Depending on your height, if you're going to buy a ball, they usually have height recommendations on there. However, if you're lucky enough to go somewhere like a gym that has multiple sizes, you may want to try them out, especially if you're close or right around one of the height requirements, because it kind of depends on how long your legs are compared to your torso as well. So when you sit on the ball, you would really want your knees around your hip height. So This, you can tell when I sit on this ball, my hips are dropping a little below my knees. So then if I size up to the bigger ball, my hips now are a little bit above my knees. Now, obviously with either one of these balls, I could make it work by pumping it up a little or letting some air out to make it exact. Sometimes in pregnancy, you're gonna want your hips to be a little bit above your knees in order to give yourself a little bit more vertical space here for your baby, especially if you're further along. So you usually want to err on the side of having your hips be a little bit above your knees or even with them, but not below. So of these two balls, I'm gonna actually do my exercises today on this blue ball, which is a 75 centimeter ball. I am about 5'11", so they usually recommend right around 6 feet to be going up to the 75 centimeter ball. So stability balls are great in pregnancy and postpartum for improving and challenging your balance. It's kind of a forgiving surface to be sitting on during pregnancy and postpartum in terms of your pelvic floor. And they're also used quite often for labor in all kinds of settings. What I'm going to be showing you today is not exercises for labor. There's very different purpose of use when they're used during labor compared to what we're going to focus on right now. But we are going to focus on some gentle pelvic mobility and a lot more of kind of stability exercises. You can always check with your provider if you've never exercised before or anything in this. If you're trying things, it's not working, it's hurting, then I would definitely recommend checking in with your provider and or obviously not doing what I'm going to show you if anything is bothering you. All right, so let's go. Okay, so obviously this video is focused on exercises with a stability, or some people call it a Swiss ball. If you're looking for some other exercises if you don't happen to have a Swiss ball available to you, if you check out any of my other episodes, we have an upper body strengthening and a lower body strengthening episode. I think they're 4 and 5. Also in the low back and upper back episodes, I talk about a lot of various exercise, pelvic as well. And all of the exercises that I talk about in any episode do usually incorporate some kind of core abdominal engagement. Again, we don't want to be doing heavy crunches or anything that puts a really large demand on your abdominals because they are so overstretched that it puts you more at risk for separation, as well as they just aren't they don't have a very good advantage to be working. So we want to engage them gently and so that they're giving you appropriate amount of support, but we do not want to overwork them. So the first thing that I want you to do when you're sitting on the ball, you want to be upright, you want your feet flat on the floor. I do like if you can do this barefoot, but I think it works better with shoes just so you have some traction. And you are going to want something, whether it be a wall or a table or something that in case you were to get off balance, that you don't topple over. So something to help you with your balance if needed. So the first thing I'm going to do is just like a pelvic tilt, which is basically where you're going to roll or scoop your tailbone underneath you and then back up. So it's a pretty small movement. A lot of times what you'll see people doing exercise-wise on the ball is going, under and then all the way back where they're arching. And I usually do modify that where you're just, you're not going to go all the way back to that arch position, because that is the position, if you've seen any of my other episodes, that you're kind of already putting a lot of pressure on your back. And by arching your back and sticking your pelvis back, it does put an excessive amount of pressure on both the muscles and the joints and discs in your back when they're already kind of a large demand is being placed on them just from the weight of the baby. So we're just trying to counteract that. So you're going to scoop under and then back up. The other thing you're going to want to be careful of, if you're ever searching for any of other ball stability exercises on the internet, is you want to try to keep your torso kind of centered and upright. So you'll see a lot of people that will go back and forth, and a lot of the exercises I'm going to show you, you'll see them like tipping side to side, and you'll see the ball rolling quite a bit, as well as their torso tipping over side to side, front to back, or around in circles. So what we want to try to do in terms of a core stability point of view is the more centered you can keep your torso, the more your core actually does have to work to do the movement just with your pelvis and keep everything stable. Whereas if I counteract that movement by swinging forward like this with my pelvis and rolling or throwing my torso back, then I'm not doing much in terms of my core. I'm more just shifting my weight back and forward. So again, I'll do it from the side here. So you can obviously, if you put your feet a little bit more narrow, it's going to challenge your balance a little bit more. If you put them wide, it can be a little more comfortable. But again, you're going to tuck your tailbone under like you're trying to bring your belly button or your baby up toward your nose, and then back. So the ball should move a little bit, but not a ton. It should not look like this, where your knees are going forward a lot. And you could do repetitions of this if this is comfortable for you, or you could just hold it and breathe. You could also hold it and do a little bit of bouncing. Bouncing provides some just feedback through your pelvic floor, which can feel good, but it also can provide some kind of perturbation for your abs to make them a little bit more challenged. So there's that one. Then we're gonna do, usually you'll see, like I said, the circles. I like doing circles, but actually I like doing semicircles or half circles. So instead of moving in a full circle with your pelvis, so if you are going to try to draw a circle on the ball with your, say, your tailbone, if your tailbone had a marker on the end of it, and you're trying to draw the largest circle you can, if you can do that without pain, you can try doing that. I don't love the part where you really arch back and try to draw the circle back this way. So what I encourage people to do is kind of stop at the sides. So you're going to go tip to one side, and when you tip, you're going to try to focus on hiking up the hip that you're going to, and then you're going to roll under. So I'm rolling and doing that tilt again, and I'm going to this side. And again, I'm focusing on hiking this hip up. I'm not focusing on pushing this hip into the ball. A lot of times if you focus on shoving one hip into the ball, that can put more pressure on your pelvis and your pelvic floor, compared to if you focus on hiking up, it's going to focus on your kind of oblique ab here in your core more so. So you're going to go both directions, nice and slow. And you want to keep breathing while you do this. But again, it looks like very small movement, and again, it should not look like you are doing this, where it looks like my torso is really tipping or the ball is really moving quite a lot. So the next one you're going to do is going to kind of be similar, but you're going to basically just do one side. So you're going to focus on one side. You're going to scoop your tailbone under and try to go kind of in a diagonal. So instead of going all the way around like this, you're going to scoop it almost like a V shape. So you're going to scoop it and go one way. And again, the direction that I'm going, I'm trying to hike up and then come down and go the other way and then down. And if you're really trying to pull up, you might feel a stretch on the opposite side, which can feel nice. And then the other way. You can add, if you feel comfortable, you would want to bring your knees a little bit more about hip width apart on this one. But you can add a little bit of a hip shift to this if it's comfortable for you. So you're going to scoop up and forward with your tailbone as you push your hip back. So if I look down at my knees, my left knee right now is pulling back and it looks shorter than my right knee. And again, I would hold it. I could add a little bounce if I wanted to, make it a little more challenging. And then I will go to the other side. So I'm going to scoop up and forward this way, and I'm going to shift back on that knee. And this will incorporate a little bit of my inner thigh, a little bit more of my glute muscle on that side. And again, I can pulse. If that hip shift bothers your pelvis, then just drop that off and just do the pelvic kind of V motions. The other thing you can do is you can add an arm reach to kind of ante up the abdominal activity with any of these exercises. So in particular, I'm going to turn to the side here. When you're doing your pelvic tilts where you're scooping under, if I were to add a little bit of a gentle forward reach, when I reach forward, I'm not bending like this with my torso. I want my arms to go forward and my belly and chest to kind of curve back. So it kind of exaggerates that curve, but it really does engage your abdominals a little bit more. And what you want to do is hold it and breathe. You probably won't be able to hold this quite as long because it gives you less space to breathe. But it can really ante up and get not only those lower abdominals that we're working on, but it can incorporate more of the upper abdominals as well. And you could do, as you're doing your V shape, you could reach to that side. So you scoop up and reach. And you can reach with one arm. I actually think it's better to reach with both because then you get both obliques working. And then the other side. And again, you could add that hip shift, scoop up, shift back. You want to hold it for a couple breaths. Come back to center. Other side. Again, keep in mind, I am not going, when I come up to center, meaning I'm just vertical, I am not tucking under and going all the way back like this where my back arches. This is not center. So center would be here where your back is a little bit more flat. So you're going from here and then moving under, coming back to here. And then I wanted to show you two other quick ones. I'm going to scoot back a little bit. You can do a bridge on the ball, which can really work your glutes. So what you're going to do is as you're sitting on the ball, and again, you probably want something next to you so that you have it for balance. You're going to gently walk your feet out. This is where it helps if you have tennis shoes on, because, oops, I'm going to move back a little bit. It helps if you have tennis shoes because otherwise you can kind of slip. But you want to get to a comfortable place where it doesn't feel like your feet or the ball is slipping. But you want to be upright, especially if you're later than 20 weeks in your pregnancy, at least at a 30-degree angle. So depending, I mean, I can go down like this. There's going to be a point if I go too low that the ball will kind of start to skid that way. But I want to move my feet out enough that I can put my pressure through my heels. And then I'm going to do that tailbone tuck. And I'm going to lift a little bit. And I'm going to lower. And when I do this, I want to try not to lift all the way up where my back arches. So it's more about going down, lifting up a little bit, only to the point where you can keep your butt tucked under. And I'm going to keep breathing. So you can do repetitions and you can really feel your glutes. You can also, to make it even harder, put a band around your thighs right here, and that will work your glutes even more. However, you want to make sure that you're, and the other thing you can do is pulse. So if I wanted to go here and just pulse here, or if I wanted to pulse lower, I could do that. Make sure the pressure is going through your heels, not the balls of your feet. And you should feel both your glutes and your quads working. And then a nice stretch to end on is in this position, you just push back a little bit. You still want to be in a reclined position, so you don't want to push all the way back where you're straight. But if you open up your arms, and this is a really nice chest stretch, especially with all the extra demand that and weight of our breasts that pull forward, make our chest really tight. This can be a really nice stretch, and it can be a nice way to end. And the other thing is, as you're holding this, you can tell I'm lifting and clenching up here so I can feel my glutes working at the same time, which is a nice double whammy. You want to make sure that your head relaxes on the ball when you do this, and you're not doing it like this. And as you breathe, you're trying to let your chest drop down. You do not want to arch your back. It's kind of the theme, right? So, to come back up, you're going to just roll yourself back up. All right, so hopefully, I know I talked a lot, but if you go through these exercises, however often seems helpful to you, you could do them on a daily basis, you can do them on a weekly basis, a couple times a week, whatever seems helpful to you. But if this is helpful at all to you, please give us a thumbs up and make sure you subscribe and hit that bell icon to get more notifications of our future episodes. And I believe next week will be my last episode. So stay tuned because I have a surprise for you. All right, take care.